COVID-19 has spread globally and it is challenging the Philippine government, health systems, and institutions to effectively respond to it. The Philippines has a dual and decentralized health system composed of public and private sectors, with local government units being responsible for finance and operations. Due to its resource and capability limits, the Philippines have continued to face public health problems over the last decade. We have disaster preparedness plans, therefore disaster response is better geared for typhoons and floods rather than fighting epidemics. Consequently, our limited resources and capacity make it difficult to adequately respond to public health emergencies such as COVID-19. As the health system lacks sufficient surge to safely tackle a national COVID-19 outbreak, there are a shortage of personal protective equipment, lack of mechanical ventilations, and shortage of hospitals with ICUs and isolation beds. More significantly, the inadequate number of health workers is a major concern, especially in areas outside the metropolitan region. The overall healthcare system in the Philippines is of a high standard. The Filipino medical staffs are well trained, yet facilities in the country are not as good as those in other high-end hospitals located in other countries. Moreover, the quality of the country's public health care is good. It ranges from excellent in urban centers to poor in rural areas. On the other hand, its private healthcare provides more comprehensive care and its facilities are fully equipped better than the public ones. The Philippines still struggles with unequal access.
COVID-19 has significantly affected the people's livelihood and health. The government is doing their jobs, and I hope that the Filipinos will also do their responsibilities so this nightmare would come to an end. The Philippine Health Insurance Corporation, are also known as PhilHealth, which has been helping finance COVID-19 testing and treatment in the country, has been rocked with various allegations of fund mismanagement and overpricing. Our country was already suffering because of the coronavirus pandemic, and now the Philippines is in the middle of an alleged corruption scandal. As we all know, PhilHealth is a public health care provider in the Philippines and it plays a vital role in the country's health agenda. It is funded by the contributions paid by indirect members and the government. The Philippine Senate, which serves as the upper house of the country's legislative body, approved a report recommending the filing of charges of corruption against several senior officials of the corporation. PhilHealth released its official statement on allegations of irregularities and corruption last July 31, 2020. They claim that the allegations coming out in some broadsheets against their corporation and its executives are either false, twisted half-truths, or misinformation. Whether the allegations were true or not, PhilHealth should rethink their purpose, and if they are guilty, they should reflect on their mistakes and make decisions that should be done in order to help uplift the lives of Filipinos, for they are the one who can free the marginalized from this misery.